Yes, good afternoon once again, everyone. I am very delighted to be here today on the June's episode of the Protect Mom and Child webinar. I am excited today because I have an amazing pediatrician in the house. Like, she has everything we need to discuss today on this important topic of jaundice, and she will be taking us through everything about jaundice to improve ante and postnatal maternal knowledge, particularly, regarding jaundice in Nigeria. Please welcome with me today, Dr. Minka Ndifon. I hope I pronounced it correctly.
Well, Ndifon is
In
the
the form,
pronunciation.
I'm sorry,
Ndifon. No,
apologies.
it's
Dr.
okay.
Minka in the form. She is a 2023 International Maternal Newborn Ed Fellow. She's an amazing person. She's a pediatrician, a pediatric resident with Federal Medical Center, Abuja, Nigeria. She would be on the conversation seat today to take us through everything regarding jaundice, also called hyperbilirubinemia. She's going to be discussing that with us today, giving us all of the important information to assist mothers and even parents to navigate through this particular period of a newborn's life. Thank you so much, Dr. Minka. Welcome to today's edition of the Protect Mom and Child Forum.
Thank you so much, Yetunde. It's such a pleasure to be here. And good evening to all our viewers. I trust that this will be a wonderful time and you would learn a lot. Thank you so much for having me.
Thank you, Dr. Minka. I'm so excited to have you today. So diving through into what we have to discuss today, very first thing I want us to first of all establish today is the fact that the high rates of mortality due to jaundice in Sub-Saharan Africa and South Asia is at an alarming rate. And it brings us to the fact that we want to start thinking about why do we have these high rates of neonatal jaundice mortality in these regions.
Okay, thank you so much, Yetunde. One of the things we've noticed over time is one, the health seeking behaviors like for Sub-Saharan Africa is not that great. So if a mother was to see jaundice, there's every possibility that she may not seek medical advice or go to the hospital. And we've seen that there's also a knowledge gap because we see that mothers who are more educated are more likely to seek healthcare, are more likely to go to the hospital if they notice that the child is jaundiced. So that is one thing that has affected, women in this part of the world, that is Sub-Saharan Africa. There are other things that contribute to a child having jaundice or it being more prevalent in terms of the topography of where they live. So but majorly for our region it has been the knowledge gap and also the poor health seeking behavior among our mothers.
So, looking at what you just mentioned now, particularly in this part of the world whereby the healthcare seeking behavior, like you mentioned, is very, very poor, right? And the
Yeah.
fact that there is limited parental knowledge in many of, high mortality causing conditions for children in this part of the country. We'll also be discussing that and what solutions we can bring as people in the maternal and newborn aid community to address this gap to ensure that we reduce newborn mortality in this part of the world. So diving now into the next thing we'll be discussing today, Dr. Minka, is that what exactly is jaundice and how do we know that a child, has jaundice?
Okay, thank you for that question. So, funny enough, the word jaundice comes from the French word jaune, which is yellow. So, when you notice that a child has yellow eyes, yellow skin, that's usually what we check. We say it's jaundice. I know our webinar topic is hyperbilirubinemia. So, that's the medical term. That's when you have increased levels of bilirubin in the blood because that pigment bilirubin is what causes the skin to be yellow, is what causes the eyes to be yellow. So when we say a child has jaundice, is because the child has a yellowish color either in the eyes or on the skin. So when we see that, we say there is neonatal jaundice, and commonly it's seen within the first 7 days of life.
So thank you very much, Dr. Minka. So I would just want to ask, is it possible that is jaundice preventable? Probably maybe from when the mother is pregnant? Is there some healthy lifestyle that a mother is supposed to, encourage herself to go through to be able to prevent, jaundice in a newborn? Are there instances like that?
So jaundice is not preventable, and I'll tell you why. We've seen that out of every, like, 60% of term babies, when we say term babies, babies that have been carried for up to 9 months, 60% of them will have jaundice. Now, for preterm babies, up to 80% will have jaundice. There are several causes of jaundice. So there's what we call pathologic jaundice, physiologic jaundice. There are other ways that we classify jaundice. So when we look at a child with jaundice, we're thinking of one, two, three, four, five possible causes of jaundice that we need to rule out. So if we're able to rule out the common possible causes and the child still has jaundice, we call it physiologic jaundice. So because of the way a baby is, babies generally have a higher, what we would call a PCV. So they have more blood cells than adults, and these blood cells too are broken down much faster. So it's the breakdown of the blood cells that eventually leads to the increase in the bilirubin in the blood. That's a pigment that is broken down in that process. So when this is increased, it causes, the more red cells, the more bilirubin. And so that's what we see in the newborn as they are adjusting to this new life. So for some, it rises and it falls eventually. But there's always the fear that it can rise a lot higher than expected. And our biggest fear is the fact that when this pigment gets to the brain, the effects are lifelong. So that's the fear for we pediatricians. So we always want to rule out all the possible causes before we say, okay, this is physiologic, it would come and it would go. But we expect that more than half of the babies that are born will have jaundice. It's just about the severity of it.
Now, thank you so much, Dr. Minka. You just mentioned something now, that there is an expected level which this has
Yes.
to get for you to be able to say, oh, this is pathologic, this is physiologic. But if you're going to dive deep into that, because I want you to give more robust explanation on that, when can
Okay.
we say that jaundice becomes life-threatening to a newborn?
Okay. So just going back before I talk about life threatening. So if you ever see jaundice on the first day, it means there is something else going on. You would not think it's the normal one that some children have. So jaundice on the first day must be investigated. Whenever we hear, maybe I gave birth this morning, by evening my child's eyes are yellow, a lot of other things are going through our mind. So jaundice on the first day calls for immediate medical attention. Now, jaundice that is life threatening, and we don't even want to get there because most times at that point, the damage is already done. So a mother comes and says, my child's eyes have been yellow, it's getting worse. My child is not able to suck well anymore. My child is lethargic. My child is having abnormal movements or convulsions. Those are things that we don't even want to hear because at that point, the damage is almost always irreversible, almost always. So usually if we notice that once the mother is saying there's a progression in the yellowness, because normally the yellowness starts from the head and begins to go down to the chest, abdomen, that already should be investigated. But when we say it's life threatening, the child is not feeding appropriately, is refusing, has poor suck, has abnormal movements, those are things that would often carry a poor prognosis.
Thank you so much, Dr. Minka. Just from what you're just explaining now, is the fact that once there is a discovery that the child's eyes is yellow, it requires an urgent medical attention with immediate effect. No, for instance, if we now want to go to places like rural communities whereby we do not have, they do not have access to air care facilities as those of people in the urban centers. How do we navigate those kind of scenarios? How do mothers be able to say that and be able to protect their child, from this jaundice, particularly in the rural communities?
Thank you for that question. So the first thing I would say is the ability to identify. Because if you're going to even say maybe you have to go to the next community for any sort of treatment, you should have identified that this is not normal. So for the rural communities, the first thing is still the importance of knowledge. So that if a mother notices that her baby's eyes are yellow, that already is something. Okay, let's investigate and know what is done. So the healthcare providers in that setting, whether it's a community health worker, would say, okay, this is where you need to go here and have this test done. Something else I need to stress, even for the mothers, because we know we're talking about prenatal and postnatal. Now, the mother being aware of her blood group is important, because we have found that at times mothers who have blood group O and their babies who have a discordant or a different blood group, that baby has some risk of jaundice. So if a mother knows that, okay, my blood group is O positive, she's on the lookout to know, will my baby develop jaundice? If my previous child has had jaundice, I need to also be on the lookout to know, is there a possibility, so that I believe that should be part of the birth preparedness. As much as you prepare for the child, you anticipate that if this is to occur, maybe I have to reach the next community and just have an assessment. Unfortunately, we don't have a lot of point of care devices. They are available, yes, in the market, but we don't have them in a lot of our rural communities to test, to test the level of jaundice, so that when you don't have access to the lab, you could use this point of care devices. It's in some parts of Africa, but to the best of my knowledge, it's not something very common in this part of the world, like in our country.
Thank you very much, Dr. Minka. This point of care that you just mentioned would be part of what I want us to talk about, probably at the later part of the webinar. If, there's something that our government can do, probably, maybe we have them at specific places whereby mothers can go to and use them, probably after their newborns, after their children, and after they have their babies and all of those things. We'll probably talk about those at the later part of the webinar. So basically, for instance, in my country, Nigeria, we have some myths and misconceptions about jaundice.
Yes.
And it's, because I've seen a lot of it.
Yeah.
There was a time 2 or 3 years ago, I saw there was a story that was told to me of a mother that the baby had jaundice, and then they had to tell her, the elders in the family had to tell her to place the baby's eyes up to the sun, so that the jaundice can wipe away. I really want us to talk about this, for public
Yes.
awareness cases,
Yes.
for mothers to be able to understand that the standard treatment for jaundice is this, and this are not the standard treatment for jaundice, and what steps they should take when they realize that their newborn, has jaundice. Thank you.
Thank you. So that is, that is the most common misconception that I have to even deal with in my practice. So the mother comes in that I was told to put my baby under the sun. That is not the cure for jaundice. Unfortunately, there are still some healthcare providers who also tell, the patient or the mother to put the child under the sun. It does not work. And I'll tell you why. So the mainstay of treatment, one of the mainstay is phototherapy. But a bit of science, a bit of, let's say, physics now. The sun has several types of UV lights with different wavelengths. So sunlight in itself is not going to solve the problem. There are particular, call them UV rays, that at a certain type of nanometer or wavelength rather, that is useful in jaundice. So putting the child under the sun, what that does is that it now delays them seeking care, because somewhere in their mind they believe it's working and they never get to the hospital on time until maybe the child stops sucking and the child is lethargic. That's when they go to the hospital. So this sunlight delays. Now the other issues are because perhaps in the past a child was put under the sun and the child was fine. What that means is that it's likely that what that child had was a physiologic jaundice, the type that just comes. So, but it's not because of the sun that that child was fine. So it's always best to have an objective assessment to say, okay, this is the level of the bilirubin. this is what we need to do, as opposed to putting the child under the sun. But putting the child under the sun does not cure jaundice. Sometimes that even causes more harm, because you're exposing this child to harmful rays, you're exposing this child to that heat, and can even cause dehydration for the child. So it's best that once that is noticed, seek medical advice. Thank you.
Thank you, Mika, because you know what? It is really important that we address that, especially, for
Yes,
mothers, when they have they're newly delivered, and they see stuffs like that, they start having different kinds of advices from
that's
different
very, very
quarters.
true.
Doing
Very
this, oh, we
true.
have done it that way. This was the way mommy something something did it. This was the way mommy something something did it. And the child was fine, and they expose these new babies into different kind of conditions that are not, that could cause more harm to the babies, to the baby's system. Thank you so much for addressing that, Dr. Minka. Very,
Thank
very
you.
fast, we'll quickly talk about the standard treatment for jaundice. I want us to talk
Okay.
about the standard treatment for jaundice. How is it carried out? How can we, and also be talking about the emotional support for parents during this period. It could be very, disastrous for parents at this period when they are looking at their child having jaundice, taking them up and down, and all of those. Thank you.
Thank you. So that's very important. And I don't think, well, I would always advise my patient, there's no need to be scared. What's important, because knowledge is power. So if you're aware and you show up early and the right intervention is given, no child should have to die from jaundice. It's not something that, because it's a natural progression. We expect to see it, but we make sure that it's not beyond what is appropriate or the level that is dangerous. So if they're coming to seek health care, the mother should go home with a healthy baby. So what we do, like as healthcare professionals, when a mother comes in and you notice the child to be jaundice, yes, there are clinical assessments that we do where you maybe blanch the skin and you notice that it's yellow. It's clinical, and it's possible that it's somewhat subjective. So it's always still best to have a test done. So whilst you notice the eyes to be yellow, it gives a possible assessment of what the level of bilirubin may be. But it's always good to have an objective assessment, because that determines what type of treatment you would give. So usually the first line, if I would say, is to put the child under what we call phototherapy, but that also depends on the level of the bilirubin and the day of life for that child. So the child, and also the type, but that would determine the type of intervention. Like I said earlier, several things can cause um, hyperbilirubinemia or jaundice. So you also need to find out the underlying cause and treat appropriately. For example, a child can have sepsis, which is just like a neonatal infection that can cause jaundice. So whilst you're treating that jaundice, you still need to treat that infection and give antibiotics. If the mother is O positive and the child has a different blood group, you treat appropriately. So at that point, one of the things you do is to know the child's blood group, and then also put the child under phototherapy. So the phototherapy itself would definitely break down the bilirubin and also reduce the level of the bilirubin and jaundice eventually. But we must treat the underlying cause. So there are a few investigations depending on your facility that you can do, because we unfortunately our settings are more or less resource limited, so we don't do a barrage of tests, but we test for the common things that can cause jaundice. And I would also like to stress something that's very important. There's something called G6PD deficiency. G6PD, it stands for glucose 6 phosphate dehydrogenase. It's an enzyme, so this is seen more in boys. So we have found that when boys are exposed to things like camphor, mothballs, that can actually cause jaundice. So when you're meeting a mother, if she has had a male child before that had maybe severe jaundice or something of that sort, as a healthcare provider, there should be a high index of suspicion. There are some centers, most likely tertiary, that can test if this boy child lacks that enzyme. It's not always the case. So that's why when they come in, if it's high, if it's clinically significant, you need to put the child under a light, and then you monitor. You also need to monitor your treatment, that if you're giving this intervention, is it working, is it not working? If you're seeing it as a severe or life-threatening case, there are times we need to exchange that blood, because the blood has a high level of bilirubin. There's a procedure where the blood is exchanged. We get a blood that doesn't have that bilirubin, and we take out the one that has from the child and put in that one, and we still give phototherapy. So that's the common treatment that is given for neonatal jaundice.
Thank you very much for this, robust breakdown, Dr. Minka. So for me to just cap everything you have said now, I liked it that the very first thing that you would do when they bring those kind of case to the facility would be an overall assessment based on, what you see in the child. You do the blood test for that child. You try to check the day of life for that child, and all of those things. Then after
Yeah.
those, that is when you now start your treatment of the phototherapy, if I'm right, based on what you have
Yes.
said.
Yes.
Awesome.
So whilst we do those tests, based on the results we see, that would determine that, okay, this is the next step. You could either say, okay, I'm seeing a certain value on the fourth day of life. Maybe you can come back tomorrow. Let's repeat it to see, is it rising? Is it falling? If it's falling, there may be no need for phototherapy. But if I'm seeing a certain value that is quite high early on in life, maybe the second or third day, I would say, okay, we need to keep you back and, investigate further and even commence treatment. So those are the things that we consider when a child shows up with jaundice.
Thank you, Dr. Maincard. From one of the things we have discussed today, and I hope that people, mothers, fathers, uncles, aunties, that will come across this information will be able to know steps to take when they see newborns. It may be their newborn, maybe the newborn of their
Yes.
neighbor. Maybe, they will have more information on how to be able to, the next steps to take once they see this kind of condition in whoever's newborn, they come across to. Thank you so much, Dr. Minka. So I just want us to wrap up this session by giving us your key messages, and I want you to direct these key messages to about 4 to 5 key stakeholders in the maternal and newborn health community, in the maternal and newborn health space, right? I want you to direct it first to the parents themselves. Then I want you to direct it to family members, because they play key roles in newborn's health. We cannot even rule that out,
Yes, I
particularly in the
agree.
settings like Sub-Saharan Africa, in Nigeria particularly. They play key roles in how a child would come out, the head of a newborn. I've seen cases whereby some family members will tell mothers to put there's a particular ointment that they will tell a newborn mother, a new mother, to pour on the head of the child, because they say the child has something called, in Yoruba land they call it oka. In Yoruba land, they would say that you put it on the all sorts of
Yes,
advice comes from family members, and it's important that we direct our public awareness to this
I
set
agree.
of people. Number three, I want us to also direct your key message to the government. I know that in our healthcare facilities that we have in Nigeria, we are resource constrained. We all know that. But how can the government also continue to, kind of subsidize healthcare delivery to people, particularly in rural communities whereby healthcare services, is zero to none in those kinds of places. Number four, I also want us to also direct our key messages to religious leaders. Believe
Yes.
you me, in our settings, they play key roles in maternal and newborn, healthcare, services, and all of those. Thank you so much, Dr. Minka.
Thank you so much. So I'll start with the caregivers, the parents. Most important thing is that ability to identify. So once it is noticed, please seek professional advice. It's better to go to the hospital and you're told this is fine, come back, let's monitor, than to stay at home and watch your child deteriorate because of something that your neighbor told you. One thing again I want to stress for the mothers, especially mothers who are pregnant. I know it can be stressful going for antenatal care, but this is one of the things they also give, like counseling, especially when it's close to birth. So try and attend the classes. Don't just go to see the doctor and then you leave without being part of the counseling classes that happen before you see the doctor, because that is one other avenue where people are being educated about jaundice, about things to look out for. If you go for immunization, you can ask the nurse seeing your child, the healthcare provider, that can you have a look? Is there anything you have noticed? It's always good to always even ask questions when you're with any healthcare provider. So for the caregivers, it's one, being aware of the fact that it's a possibility, and be on the lookout. Look at your baby, observe the eyes, observe the skin. If you notice anything untoward, seek appropriate care. For the family members, the fact that something has worked in the past, it's because we don't know. But there are so many cases that because the level is so high, it has led to problems. Do you know that jaundice is actually one of the cause severe jaundice, sorry, can actually cause cerebral palsy in the long run. So whilst we treat the child then and it seems the child is out of the woods, especially if it's severe and it has gotten to the brain, we find that months later, this child is having issues meeting with his or her milestones, and ultimately they come down with cerebral palsy. So jaundice can also lead to that in the long run. It can cause deafness in the long run. So if you even wait, it would be cost effective to make sure your child is treated now than to now have to think about special schools in the future for your child because of cerebral palsy. So as family members, it's important that we encourage our first time moms, encourage those around us, that we our yes, our moms, to seek appropriate care. Just get that professional opinion that says, okay, this is fine, this is mild, okay, come back tomorrow, let's monitor, do this, do that, let's be sure it's not this, it's not that. So it's always very important, the place of even avoiding things that can cause jaundice. For example, like I mentioned, the G6PD deficiency, you can still keep your baby's clothes without mothballs. There are other options for using camphor, like sweetest medicine, because we have no seen commonly that camphor can actually cause jaundice. For our government, I mean, we could hammer this, but healthcare is money and we need to fund healthcare. It's something that we've been advocating for years in different sectors, or different groups, the importance of, funding healthcare. Because for rural settings, I talked about point of care devices. These point of care devices, they cost money, but they would help in, determining what's the level of jaundice as much as possible. Yes, there's nothing that is 100% accurate, but it would be useful to reduce the amount of morbidity or mortality that comes from jaundice. So for the government, the place of funding in terms of providing the necessary equipment, phototherapy lamps, for example, should be available at our primary healthcare centers. And even the constant messaging, you will find that in rural places, chances are many people still listen to
Hi, Dr. Minka. Hi. We lost you. We can't hear you again. Hi, Dr. Minka. Oh, possibly that's a network issue. I think she'll be back very soon. So thank you so much for attending this webinar today. I don't know if we have questions. If we have questions, we need clarifications on what we've been discussing today, everything about jaundice. Please drop it in the chat box. I will be reading it to Dr. Minka. And once she's back online, she would be able to address all of the questions. We have contributions. Please drop them on the chat box. I'll read them out and we'll be able to address all of those. Welcome back. I guess it's
Thank
the
you.
network. Yes, I
Yes,
know.
sorry about that, everyone. So I was talking about what the government can do, and I talked about the place of funding. Truth
Yeah.
be told, healthcare is money, and that's one of the things we keep advocating for in terms of more funding for health, the place of community-based health insurance. We've been able to pool resources to provide certain things in our healthcare facilities. Like I said,
Mm-hmm.
phototherapy lamps being available. And ultimately, I want to go back to the place of health education, pushing out
Mm-hmm.
this information on accessible platforms. I was talking about the fact that for a rural setting, the mother may not have a smartphone or even talk about using the internet, but it's likely
Mm-hmm.
there's a radio in the
Yeah, the radio.
community.
Mm-hmm.
Exactly. So we
Mm-hmm.
can also make use of that medium to push out information to get people aware. I think
Mm-hmm.
awareness is really the one of the critical steps to getting people to preventing the long-term mortality that comes with
Mm-hmm.
jaundice. So when mothers are aware, when
Mm-hmm.
they get to the hospital, they're even able to ask appropriate questions so
Mm-hmm.
that that way the healthcare provider can tell them, okay, this is what you need to look out for. If you
Mm-hmm.
notice this, if you notice that, this is what you do. So it's very important that the government push resources, to that rural setting, making
Mm-hmm.
such things available for our children. Then I would like to add also training, because yes, this is the advent of AI, but there's
Yeah,
still some things that you need human beings to know how to
we
do.
do. Yeah.
Yes. So
Mm-hmm.
if we need, we're losing so many doctors. So such clinical skills are not for a certain few. So whether it's a community health worker, whoever it is in that setting should know how to identify and what the next step is. So that training should go across different health cadres, because anybody can meet a newborn. Even if you may not know you shouldn't even know the treatment. You tell them, okay, this is the next step. Give them the right information on the next thing to do. So that training is extremely important at all levels. That is very, very important. So I think you mentioned the for the government. Um, yes. Okay. I think I missed the last person I'm to address.
The last one is the healthcare provider, and I'm particular about traditional birth attendants.
Yes. Okay,
Yes.
yes. Thank you. Thank you for that traditional birth attendance. So again, what we practice is evidence-based medicine. And ultimately, we want our babies to be safe. We want our mothers to be safe. For me, it breaks my heart to know that a mother would have carried a child for 9 months and was okay, and all of a sudden she has to go back to the hospital and maybe not come back with her child, or something untoward happens, or later down the line she notices her child can't hear or her child has cerebral palsy, when it could have been prevented. That is one thing that breaks my heart, that this could have been prevented. And I think one of the things that we've always advocated for is collaboration. The traditional birth attendants are a part of our culture. They're a part of healthcare in Nigeria. So instead of saying no more birth attendant, let's train them to also identify these things. So whilst, because culture still has a very strong impact on the decisions we make. So if they're going to patronize traditional birth attendants, why don't we equip the traditional birth attendants so that when they notice certain things, this is what they do. So you're not going to give the child pawpaw water when you notice jaundice. You're not going to tell them put the child under the sun when you notice jaundice. You tell them, okay, this is the level of my knowledge. I have done so much so far. I would advise that you go here. And because people listen to traditional birth attendants, what we can do is to partner with them, because ultimately everybody wants a happy mom. Everybody wants a child that is healthy. Everybody wants to know that she carried her baby for 9 months, she took her baby home, and she's able to care for that child. So it's very important that we train the traditional birth attendants. We are on the same side. I think I need to stress that, so that when we come as the people who have orthodox medicine, we're not seen as opposition. No, we're on the same side. We want mother and child to be fine. And we have seen that this is a better way to do it. So when we approach it from that point of partnership, I think it goes a long way in, getting our mothers more educated and, even reducing the burden when necessary. Thank you.
Dr. Minka, do you know what? I cannot thank you enough, for this robust information you are giving today. The fact that you stressing that traditional birth attendants are a part of us, it's really, really key, because let me tell you something. Some mothers, they trust traditional birth attendants than nurses.
I agree. I
I
agree
have
with
been
you
to some
100%.
communities whereby the only healthcare provider they have in those communities are TBAs. They don't have
Yes.
nurses, they don't have shoes, they have no orthodox healthcare provider, only TBAs. And
Yes.
if we do not equip these TBAs, I tell you, our aim to be able to say we are reducing maternal and newborn health mortality by 2030 will not come to pass and will not come to fulfillment. So it's important for
I
us
agree with
to
you.
collaborate with traditional birth attendants, to continue to even provide them with trainings when we are training nurses, training doctors.
Yes,
We should also
absolutely.
include them in our training. Inclusion is very important in the healthcare
I
settings
agree.
to be able to continue to protect and make sure that mothers and children do not die from preventable causes anymore. Thank you so much today, Dr. Minka, for
Thank
coming
you.
to the June edition
Thank
of
you
Protect
so
Mom and
much.
Child Forum. I'm so glad and I'm so happy that you could make it today and you could, give robust information on this very important, one of the leading causes of infant mortality, neonatal mortality in Nigeria and even in Sub-Saharan Africa. I'll quickly go through the questions. I want to see if we have any question so that you can quickly give answers to those ones in 1 minute. And then, okay, we don't have any question. And so, therefore, thank you again for everyone that came on the webinar today. Tejumola, Pelumi, Olu, Shore, Momizi, Jesupe, everyone. I'm glad. I hope that you've, gained something from this session today. The recordings will be made available and we can also access it, get more information, and also help, give information to our neighbors, people around us. We also have a part to also play to ensure that mothers and newborns do not die from preventable, causes anymore. Thank you again, Dr. Minka, for coming to this webinar. I'm so,
Thank
so
you.
excited to have you. Thank you, and thank you so
Thank you
much.
so much, Yetunde, for the invite. Thank
Thank
you.
you so much. On to the next webinar again, and we'll be saying thank you and bye for now. Please, Dr. Minka, stay on the studio, please. Thank you.
Okay.
Thank
Thank
you
you.
all.
Thank you to
Bye.
everyone who joined. Bye.